Hello, this is Dr. Simpson. Got dental advice for you. This is part of my series called Dentist Chronicles, as I share with you experiences and that I may have gone through with a patient or a dental situation. Obviously, I'm not going to expose any patient information, name, or likeness thereof, but um, I am doing these chronicles so you can understand kind of what a dentist goes through. Um, your dentist is human just like you are. Okay. We have feelings, we have issues, we have shortcomings. So, um, but and we're not perfect. I know I'm not. And I welcome, your feedback because you, when we as dentists are sitting in that chair or treating you or even talking to you, explaining to you, we're doing it from a professional standpoint, viewpoint, which we hope that you understand. At least I try to make it seem, you know, um, easy enough so you can understand what I'm talking. Because I know most people don't understand healthcare, oral healthcare, what dental terms and terminology are. So I try to make it as simple without insulting anybody, so a third grader can understand it. With all due respect, so I had a patient today. Actually, didn't see this person, but they called and said that they had uh, taken their braces off. Now, I don't do braces, and because they couldn't afford it, I get it. However, they wanted to see if I can take off the cement. Um, And I told my staff, I said, this was a phone call. I didn't even actually see this patient, even though this person is a patient of mine of record from the past that I've only seen a couple of times because they have not returned due to whatever reason. But now they're got braces, which I didn't know they were getting, um, and apparently couldn't afford them and took them off themselves and wanted to see if I can take off the cement. I told my staff, I said, tell that person no. I'm not going to aid and embed you being dishonest and untruthful to your orthodontist because you couldn't afford it. Now, what I recommend is you go to that orthodontist, let them know, hey, I can't afford this. What can we do? Can we work something out? You got the braces on, so apparently you thought you could afford it, but nevertheless, I'm trying to understand why you would proceed in taking braces off. Now, this person had a lot of other dental issues that I'm not sure were resolved before they got braces. Again, I saw this person only one time, actually, I think, maybe two times, but one time, and they had so many issues that they had to go to certain specialists to get certain things done, and they didn't get it done. Actually, I'm trying to figure out how did this person even get braces because I didn't refer the person to an orthodontist because they had other issues in their mouth that should have been taken care of before the orthodontist, before even thinking about straightening their teeth with infection and rotten, decayed areas and things like that or whatever. So, um, nevertheless, I'm just not understanding. Of course, you only hear my side of the story, but I'm not going to um, aid and embed someone being dishonest to the orthodontist or somebody by taking the braces off, and then I'm going to go back and clean up so they can still not owe uh, or not pay or not rectify the situation. It's not really about the money with me; it's about the principle. If you're going to stiff an orthodontist, you're going to stiff me. That's the way I look at it, and I'm just not a part of that. am I wrong in thinking like that? This patient is welcome to come and see me, but I'm not going to proceed with any work if there's any orthodontic work that is in the way, which more than likely, if it's still on the teeth, it is in the way of me doing anything that I may need to do. But I know we are all humans. I get that, and I know we all make mistakes. Lord knows I do. But when it comes to what I feel is dental dishonesty, it's a dangerous slope, and I'm pretty sure there are dentists, and that can help this type of situation. But and I probably can too, but I just don't feel comfortable doing that. And the fact that this person called and to see if I can help remove the braces or the braces material that they started to take off because they couldn't afford the work. That's just not the way you do it, in my opinion. Number one, that could be dangerous because you are taking dental matters in your own hands that you really don't know what's going to happen. So, luckily, this person did not hopefully damage themselves. But again, uh, sorry, but not sorry for ranting. This is what these dental chronicles are about. It's really to kind of share with you um, issues, good and bad, that I go through, that probably other dentists go through too, that you can see from a patient standpoint. And also, like I said, please comment. Please let me know if I'm wrong, okay, for not wanting to um, help this person dodge their responsibilities at another dental office. Does that make sense? Um, and then if this person does come back to my office, maybe they will, maybe they won't, um, and they have this orthodontic uh, material still on their teeth, I'm going to let them know, hey, and I'm not going to be mad. I ain't taking it personal, but you need to clear this up. You need to finish what you started. Even if you can't finish, go back to that orthodontist, close out your case officially uh, uh, with him or her, and get your teeth and the not the equipment, but the material uh, removed, and hopefully it's reestablish a relationship with that person, and let them know you know um, what shortcomings you have. But again, thank you for listening to me. Again, I'm Dr. Simpson. I have dental advice for you. Check out my website, dentaladviceforyou.com. Follow me on TikTok, Instagram, and here at YouTube. Thank you. Have a blessed day.